Alzheimer's disease is named after German psychiatrist and pathologist Alois Alzheimer, who first described it in 1906. Alzheimer's disease is a progressive neurologic disorder that causes the brain to shrink and brain cells to die. Alzheimer's disease is the most common cause of dementia, a continuous decline in thinking, behavioral and social skills that affects a person's ability to function independently. Studies show that Alzheimer most often begins in people over 65 years of age. Although up to 10% of cases are early onset, affecting those in their 30s to mid-60s. It affects about 6% of people 65 years and older, and women more often than men. There is a common mistake that people usually think memory is designed to remember everything they want to remember. They also think that all kinds of forgetting mean they have Alzheimer's, which is not correct. Our brain is not designed to remember everything we encounter in life. You might go to your bedroom to take a book, and when you reach in bedroom you forget what you wanted to do. Another example is forgetting people's names. There are so many more other examples. So these people are panicked and afraid and stressed out. And really ashamed of these moments of forgetting, which are actually totally normal. The vast majority of what we forget every single day is totally normal and probably will be throughout your lifetime. Alzheimer's begins with a protein called amyloid beta. It's a sticky protein. It'll bind to itself and form amyloid plaques. And if enough amyloid plaques accumulate in your brain, at some point it reaches a tipping point. It causes neurofibrillary tangles, neuroinflammation, cell death, and all of the symptoms that we classically know of as Alzheimer's. Prior to that tipping point, you're symptom-free. It's sort of like if you have high cholesterol, it doesn't mean you're going to have a heart attack. So, below the tipping point, your symptoms of forgetting are all normal. Alzheimer's begins in your hippocampus, the very place in your brain that's responsible for forming new memories. The early signs of the disease include forgetting recent events or conversations. As the disease progresses, a person with Alzheimer's disease will develop severe memory impairment and lose the ability to carry out everyday tasks. They can lose track of dates, seasons, and the passage of time. Sometimes they may forget where they are or how they got there, not remembering what someone said a few minutes ago, repeating themselves over and over, because you don't remember what you just said. Routinely misplace possessions, often putting them in illogical locations. Eventually forget the names of family members and everyday objects, things that you would normally remember from last week, won't get consolidated. The reason for all these acts is because your hippocampus is under attack. Alzheimer's will move. It doesn't just stay in your hippocampus. It invades your frontal lobe, so you'll have problems with problem solving, decision making. It invades parts of your brain that have to do with where things are in space, so you might get lost in the neighborhood you've lived in your whole life. It will invade the parts of your brain that have to do with language, so you'll start having trouble coming up with words more and more. The disease will move on to your limbic system and cause changes in emotion and personality. For the vast majority of us, Alzheimer's is not our brain's destiny. Only 2% of folks have Alzheimer's, that is 100% inherited. This accumulation of amyloid plaques takes 15 to 20 years and can be influenced by how we live. So what are the things that affect those amyloid plaque levels? Sleep. For those with a busy life, it may not be possible to get 8 hours of sleep per night or even 6 or 7 hours. However, it's important that you try to get a good night's sleep as often as you can. Research has shown that poor sleep patterns, such as difficulty falling asleep or staying asleep, are associated with an increased risk of Alzheimer's disease. While you sleep, there are cells in your brain called glial cells. These are the janitors of your brain. It's the sewage and sanitation department. They get really busy clearing away all of the metabolic debris that accumulated in your brain, while you were in the business of being awake. And one of the things it critically clears away is amyloid beta. So if you don't get enough sleep, the glial cells won't have enough time to do their jobs and you'll wake up in the morning with some extra amyloid in your brain that wasn't cleared away. If this happens over decades, right, 15 to 20 years of amyloid plaque accumulation, you are increasing your risk of developing Alzheimer's. Poor heart health. Research has shown that the same risk factors associated with heart disease may also increase the risk of Alzheimer's disease. These include lack of exercise, obesity, smoking or exposure to secondhand smoke, high blood pressure, high cholesterol. Those with poor cardiovascular health are also at risk to develop Alzheimer's later in life. One reason for this is that many of the same factors that impact whether or not your heart is healthy also have an effect on your mental health. More importantly, though, for the brain to properly function, it needs adequate support from your heart. If you have cardiovascular issues or your heart isn't healthy, your brain may not get the blood flow and oxygen it needs to function properly. To reduce this risk, you should make sure you live a lifestyle that promotes good cardiovascular health and see a doctor to treat any heart-related health issues. Diet. There have been many really good studies that have shown that eating a diet of fresh produce, healthy oils and foods low in saturated fat such as on a Mediterranean or MIME diet can reduce your risk of Alzheimer's from anywhere from 1/3 to 1/2. This means eating the rainbow, the leafy greens vegetables which are kale and spinach and other vegetables like broccoli and cauliflower, the brightly colored fruits and berries, fatty fishes, nuts, beans, olive oils. That's the food that's going to support your brain health and help you prevent Alzheimer's. Exercise regularly works to reduce your risk of Alzheimer's. A brisk walk for 30 minutes 4 to 5 times a week is enough to decrease your amyloid plaque levels and reduce your risk of developing Alzheimer's by 1/3 to 1/2. Chronic stress is really harmful for our memory, in creating new memories, and it will increase your risk of developing Alzheimer's in the future. There is evidence that chronic stress can accelerate aging that is the main risk factor for Alzheimer's disease. With chronic stress, your cortisol levels remain elevated. You're in a constant state of fight or flight. This is really bad for your hippocampus. It will actually shrink the size of your hippocampus by inhibiting neurogenesis. It will inhibit the birth of new neurons there. So now you've got a smaller structure that's essential for the formation of new memories and is the very first place hit by Alzheimer's. This is why we want to do things that manage stress. Yoga, meditation, mindfulness, exercise, and being with people. All of these have been shown to restore your cortisol levels, and it will restore the size of your hippocampus. Learning new things. If you've lived a life where you're cognitively active, you're regularly learning new things. You are building what we call a cognitive reserve. Every time you learn something new, you're building new synapses. In other words, you're building neural connections. The good news is that many of these lifestyle choices are just effective as well as any pill that it might develop for preventing Alzheimer's. We just have to do them. Thanks for watching, hope this video was helpful. Please like and subscribe to support this channel and stay tuned for our upcoming videos.